without medical daycare in the home, I would have to lose my job. So one of the services that we utilize quite frequently is an in-home daycare program, and that is because Charlie does not qualify for a traditional daycare setting, and he is not complex enough for a medical daycare facility. As I stated before, I'm a public school teacher, but I don't teach in the district where my children go to school, and we have different school calendars, which means there are days when I have to report for pre-service or professional development, and without my direct support personnel or my medical daycare staff, my husband would have to take off work. There were 6 years where I did not work, and I stayed at home with Charlie, advocating and just trying to get him the support and the services that he needed. When I went back into the workforce, my years of service were not recognized by my new job, and I was very fortunate to be able to negotiate with my employer that I would be a .75 staff member, meaning I'm technically full-time, and so I'm able to get primary health care insurance, and I was able to negotiate that I would not do those after-school staff meetings so that I can take him to therapy. It's a delicate web. We have to qualify for those services months in advance, and it's virtually impossible to make changes once those things are set in stone. So should those home and community-based services be cut, and they will be the first ones to be cut because they are not federally mandated. And in a state like Iowa, where we have a budget shortfall, that means that I will have to leave my job as a public school teacher, and we have a teacher shortage. There aren't a lot of us that choose to work with 8th and 9th graders. I'm one of the weird ones who does. And so without medical daycare in the home, I would have to lose my job.